Today we are sitting down with Amanda here, somebody that has had the treatment by Dr. Hardy and for interstitial cystitis and has had a great outcome so far, so she's going to tell you all a little bit about it. So how long have you been dealing with the symptoms from interstitial cystitis?
For about 15 years.
Wow. And do you remember when the first time you were diagnosed with this condition?
I do. So shortly after my oldest son was born in 2006, I began to have a lot of symptoms of UTI. I'd been treated several times by a local urgent care center and they referred me to a urologist. I saw that urologist for almost a year with no success. He definitely told me just to drink a lot of cranberry juice, eat a lot of yogurt. And after almost a year, he told me that he thought maybe this was part of the woes of being a woman and I should follow up with my OBGYN.
Wow. Okay.
So I did, and as soon as I walked into that appointment with Dr. Hardy, he took one look at my file and asked me how long I'd had interstitial cystitis, and I had no idea what that was.
Wow. Wow. What kind of symptoms did you have?
In the beginning, it was a lot of urgency, a lot of pelvic pain. Basically, anytime that you've had a UTI in your life, I felt like that all the time.
Ugh.
As it progressed, eventually the urgency kind of stopped and I stopped getting any sense of urgency. So I could sometimes go 8 or 9 hours without going to the bathroom and just be hit with a ton of pain from needing to go. I was also diagnosed with endometriosis within a few years of that diagnosis. So the two together meant that throughout certain points of the month, I would be at, very high levels of pain. With very little that we could do except to really continue to treat the symptoms.
Right. Wow. What kind of therapies did you use in the past?
I tried Almiron. That was not a great success story for me. That medication being rather expensive and needing a lot of time to fully work. I restricted my diet very heavily for a while, and while that did help, it certainly didn't end anything by any means. Mm-hmm. Stress also being a big factor with interstitial cystitis. I found myself often still in pain. Mostly I relied on rescue treatments and treating the endometriosis to at least remove that portion of it. But the bladder pain and the pelvic pain was ever present.
Wow. Wow. So about how long ago did you have the hydrodistension?
I had the surgery about 6 months ago now.
6 months, wow.
Mm-hmm. So in December, it was a quick process. I was a little sore for a few days, but after it was a fantastic response.
Wow. So what kind of changes have you seen or noticed?
I rarely have any pelvic pain. I don't have to follow my trigger food warnings as stringent as I've had to before. I can actually get up and move around freely as much as I need to, whereas before, certain long days at work would be pretty triggering on my bladder and pelvic pain. I also noticed that I actually get a normal urgency to go. So when I have to use the restroom, I go. I don't have any issues feeling like I still need to go when I get up. I'm not up in the middle of the night in pain. That's been a really
Get a good night's sleep, do you?
Yes, finally.
Awesome. So your quality of life, you would say, is much better?
Absolutely. Prior to the surgery, I was getting to a point to where I was getting actual UTIs very frequently. I haven't had one since the surgery, which is awesome.
Wow.
I'm resting better. I don't feel the need to drag myself through the day. I've only just realized in the months following that basically I was adopting a fake it till you make it philosophy every day. Wake up in pain and pretend like I feel well until I do a few hours later, and then start the process again when I went to bed every night, and I do not have to deal with that anymore.
Yay. Awesome. Well, thank you so much.
Thank you guys.
Thank you.